With warming temps, the CDC is issuing a stern warning as tick bite ER visits hit their highest levels in nearly a decade. Health officials say tick activity is at its highest spring rate since 2017, with adult ticks becoming aggressive after the winter season. Now, these pests don't jump or fly, but rather wait in tall grass to climb onto humans or sometimes even pets. Doctors say the primary concern is the spread of Lyme disease, which typically requires the tick to be attached for more than 24 hours to transmit that bacteria. Now, if you find yourself bit, here are some tips to file away on how to handle the situation.
The best way is to grab it as close to the skin as possible and pull directly out. Typically, a tick has to be embedded in your skin for more than 24 hours to transmit the bacteria that causes Lyme disease. So if you come in from the park and make sure you don't have any on you, you should be just fine.
Experts are also advising to wear long sleeves in wooded areas and performing thorough body checks on yourself and your pets immediately after coming indoors. More than 7 million Americans are living with Alzheimer's disease, and that number is expected to rise to roughly 13 million by 2050. Now, studies show exercise can help lower the risk of developing dementia, but new research from the University of Pennsylvania might explain why. They found that if you keep the fluid in your brain and your spinal cord moving or swooshing, well, it can help clear out waste and inflammation that can then cause dementia. Hospitals are training robots to move heavy stretchers. The company behind it says that it'll free up staff for direct patient care. Kaylee Tracy has a story.
Hospitals are like miniature cities. They require the movement of goods and materials 24/7.
The problem, ER Dr. David Crabb says,
in cities we have companies like Amazon and FedEx and Uber and taxis to help move people and goods and materials around. But in hospitals, we task our healthcare workers with trying to figure that out, on top of already trying to take care of the healthcare needs of all their patients.
So he started a company to have robots help. The company, Rovex, partnered with Baycare Health Systems on a pilot program that just started with the ultimate goal of using this robot to transport patients in stretchers.
We can free up a lot of time for our staff when the robot can go get the empty stretchers and the empty wheelchairs and bring them back. We want our humans right there with our patients at all times, and this can free them up to do just that. They're meant to help our team members, certainly not replace anyone.
It's a 7-month pilot at Morton Plant Hospital in Clearwater that starts with evaluating the hospital's workflow.
And then we move towards actually bringing the robot in and moving empty stretchers. Patients, it's a vulnerable population. We need to be very careful when we're rolling that out. And so our testing and evaluation and development will occur first without patients, and then as we move forward, moving with patients.
The robots grab the stretchers and tow them around. They can program the robots to tell them where to turn, when and where to back into an elevator, and more. They even have screens telling patients where they're going.
My goal is to get providers, staff members back to the bedside, being able to care with their minds and with their hearts and their hands, rather than just using some of their muscles. And so I would love to offload some of that work from them.
I'm Atiana San Miguel. Thank you for watching our story. If you'd like to see more like it, be sure to hit that subscribe button. Also, be sure to watch us weekday mornings at 7 and 11 a.m. on KCWX. Bye. See you on the next one.